Welcome and thank you all for joining us today for our online session on building resilience through volunteering during COVID-19. My name is Raida Mana and I am a member of the IAVE staff. We hope you're safe and healthy during these disturbing times and always. As the coronavirus pandemic continues affecting our world, IAVE is committed to help volunteers and volunteer organizations deal with the challenges it presents. We have prepared a series of webinars and resources to help you best respond to this crisis, including the IAVE COVID-19 Response Fund to support volunteer-led preparedness, containment, response, and recovery activities. This fund will help ensure volunteering organizations have resources to keep critical volunteering efforts strong in this time of such great need. To learn more about how to donate to the fund or apply for a grant, visit us at iave.org/COVID-19/response fund. Communities all around the world are struggling from the effects of coronavirus. During this time of uncertainty, we become susceptible to stress, fear, and feelings of isolation. However, volunteering can play a huge role in building resilience and help the community to overcome the challenges that they're facing. Today, Dr. Ben Lough of the School of Social Work at University of Illinois Urbana-Champaign will share with us his insights on how volunteers help build resilience in the communities they serve. A couple of important announcements as we start. This webinar is being recorded and will be available in our COVID-19 response website, www.iave.org/COVID-19. For questions, please type them in the question box and our moderator will convey them to our presenter. I would like to start by introducing our moderator for today's session, Ken Allen. And I have a member since 1980, Ken Allen, works in support of various initiatives and manages IAVE's administrative service. He's also IAVE's assistant treasurer and assistant secretary. From 1996 to 2001, he served as the elected volunteer world president. Ken has worked as a consultant and training in over 30 countries worldwide, helping develop organizational systems to effectively engage volunteers, designing and facilitating strategic planning processes, and advocating for corporate volunteering. For 11 years, he was a senior executive of the Points of Light Foundation. And prior to that, he led the National Center for Voluntary Action and its successor, Volunteer. In 2012, he authored The Big Tent, Corporate Volunteering in the Global Age, which was sponsored and published by the Telefonica Foundation in partnership with IAVE. Thank you, Ken, for leading today's session, and welcome everyone.
Good morning, everyone. It's a great pleasure to be here with you today from my home in Washington, D.C., where my wife, our wonderful dog Bella, and I are spending a lot of time indoors, but are being saved by the resilience factor of having a dog and being able to be out walking her almost to the point where she's beginning to resist seeing the leash come out so that we can go outside. I think we're exhausting her. This is just one of the ways that many of us are trying to stay resilient in our own lives during the pandemic crisis. So today, my job is to introduce our presenter. Then Dr. Lough will, or Ben, will make his presentation on building resilience through volunteering. We'll have the Q&A session and then do a brief wrap up at the end. Can we go to the next slide, please? Today's subject is resilience. And as Raida so well pointed out, volunteering has long been seen as a tool to help build resilience, both for those who volunteer and for the individuals and communities that they impact through their work. It's one of the ways that we prepare ourselves for the worst of what may come. It's one of the ways that we respond to the worst as it happens, and one of the ways in which we recover from those tragedies, those crises, those disasters after they've passed us by. So today, it's a great pleasure, and if we could go on to the slide about Dr. Ben, it's a great pleasure, a real honor to introduce Dr. Ben. He and I share one thing in common, and that's an association with the University of Illinois at Urbana-Champaign. And it was on that campus over 50 years ago that I learned about the power of volunteering to change people's lives and to change communities, as I was one of a small group of students who helped create a program called the Volunteer Illini Projects that now is well over 50 years old and continues to involve students in volunteer activities in the community. So it's a pleasure to be able to introduce a fellow Illini to all of you. Ben is one of the most distinguished researchers about volunteering in the world. His research, his authorship of the 2018 State of the World's Volunteer Report, the work that he's done throughout the world has really been groundbreaking. He's published over 25 peer-reviewed journal articles on international volunteering and service learning. I don't think there's any scoreboard any place to keep overall track, but he's got to be toward the top of the list there. He's been awarded more than a dozen research grants. He's done pretty much everything. And from his picture, he appears to be about maybe under 40 years old. So he's got a great career ahead of us. We're very proud of him. We're very proud to have him here with us today. And so I'm happy to turn this over to Dr. Ben and to his presentation. We'll come back at the end. Please feel free to write your questions in your question box, and we will share them with everyone and give him a chance to respond. So Dr. Ben, over to you.
Thank you much, Ken. I really appreciate the introduction. And I'm flattered that you think I'm under 40. I'm close to 40, a little bit older, but also here with my dogs in my room. So if they start barking at the squirrels out the window, I apologize. It's part of the blessing and curse from working from home. But looking forward to talking with you all today. I know I'm talking about building resilience through volunteering during COVID. Trying to advance my slide here. I don't know if I have control over that. I can't seem to advance it. As I'm working on that. So I will talk about COVID, but given the challenges of risk and instability and fragility across the world, I would say that COVID's arguably not the greatest threat to the human condition. You know, we still have a lot of armed conflict, disasters, dislocation of people. And so although I'll be talking a bit about COVID today, I'm also talking about the effects and stress of many of these different problems on the world across different countries. And so it's within this backdrop of global instability that the concept of resilience really rises to the fore and is a hot topic right now. I still can't seem to advance my slides, so I don't know if, let's see. Just a quick shout out to Raida to see if there's.
Ben, if you want, we can share them for you, and then there you go.
It looks like
yeah.
Great. Hopefully that'll work out. So yeah, again, it's within this context of fragility that we're really talking about resilience across the board, considering how it affects people. So today I'll be talking about a general discussion of volunteering for resilient communities, and then giving some case examples of values in the past where different pandemics have been helped or hindered by volunteering. So even though I'll be talking a bit about the benefits, I'm also focusing a bit on the challenges that volunteering can have for resilience in communities. And then we'll have an open discussion on resilience during this crisis. And I won't be sharing my video with you now, but I will here at the end so we can do some Q&A. All right, so why volunteering for resilience? We know that in times of stress and crisis, voluntary action is accentuated. This is a quick global trend search of the term volunteers. And as you can see, when the COVID issues started to really come to the fore, there was a big hike in people that were looking up volunteers and voluntary action. And we've all seen, I think, personal examples of this from either helping with families or having friends come over to help us, or even strangers, either formally or informally when times are hard. So today I'll be talking about volunteering, and I think, given the population on this call, most of you probably know what we're talking about when we speak of volunteering. But I also think that many of you are part of volunteer involving organizations in some way. And I'll also be speaking today about informal volunteering or direct volunteering in communities that takes place outside of organizations. And this is particularly important for countries in the global south. In the north, I know we often look at volunteering as a gap filling or a low cost human resource, and we don't often recognize it as a fundamental component of collective life, which it is in a lot of lower income countries. Voluntary action is a survival strategy. It's a way to meet their collective needs. And so part of the types of volunteering I'll be talking about today is just people helping people in times of need outside of an organizational setting. Ken did a good job of talking about resilience and what it means and giving you a good definition of that. Essentially, it just means bouncing back from hard times. The ability to bounce back during times of stress or shock is a really important component of what makes people resilient, communities resilient, and then ultimately nations. So talking again about resilience in systems, it is really nested in an ecological system where if we can think about how people can become resilient, and volunteering certainly has a component of resilience for individual people. Today I'll be focusing on community resilience, but just recognizing that that is one nested component of resilience. The idea being that if we can make our communities resilient, then we can make our nations resilient. And often that also starts at the individual level. Another point to bring up is that resilience can't be divorced from the realities of vulnerability. So it is in some ways a counterweight to vulnerability. We can't really understand resilience without understanding that it is a response to vulnerable people in vulnerable situations. And also to recognize that because not all groups are as vulnerable as others, that it does affect some people differently than others. And again, that's one of both the advantages and disadvantages of volunteering, given that it is outside of often organizational and formal settings, which I will talk about a bit later. All right, so today I'll be looking at 3 primary research questions. I am a researcher, so a lot of what I'll be talking about today is based on research. And then we'll, at the end, we'll talk about some policy implications and some practice implications. But first, I want to talk about the qualities associated with resilient communities. And we've done some research on this to find out when we talk about resilient communities, what is that exactly? And then how do the distinctive attributes of volunteering, specifically community-based volunteering, help or hinder resilient communities? And then finally, what are some of the implications during the global pandemic? So what are the qualities associated with resilient communities? How do we define this? Much of what I'll be talking about today is based on a literature review that we did for the State of the World's Volunteering Report. Ken mentioned that I was lead author and researcher for the 2018 report. And what we did doing this lit review, we read through hundreds of studies on community resilience to really understand the fundamental qualities of resilient communities. And there were certain principles that showed up consistently across these studies. I'm only going to cover 5 of those qualities today, partly because those are the 5 that are most closely associated with volunteering. There were about 8 in total, but these 5 are ones that I'm going to be giving some examples on today, and I'll be going through them fairly quickly. So if you want more information about these, I encourage you to read the 2018 State of the World's Volunteering Report. It's a good summary across the world of different case examples of how communities are resilient and how they've used volunteers in both good and bad ways to help them be resilient across time. I'm not going to go over these specific principles yet. I'll kind of cover them in the next few slides, but we'll go into some detail with case examples of each. The second question we're looking at is, how do the distinctive attributes of volunteering help or hinder community resilience? And this distinctive attributes idea is one I want to focus in on. Why do we care about the distinctive attributes of volunteering? I think because many of us work in the volunteering space, we recognize the importance of having support for voluntary action at the infrastructural level, at the policy level. And one thing that I think we have failed to do is to really sell the distinctive complementarity of volunteering. In business, this is often called the unique selling proposition. We also call it the value added. Lots of terms for this, but basically, when we think about all of the different stakeholders that make communities resilient, then what is the distinctive role that volunteering plays? We can assume that these different stakeholders all have a role to play. Volunteers can produce certain kinds of collective goods which can complement the top-down approaches. And I know there's often this policy argument about what's the role of government versus civil society. Some people have strong opinions on one side or the other. But the theory of complementarity basically says that taken together, different groups of stakeholders produce greater resilience when they collaborate. So more than anyone could produce on their own. And so although I'll be focusing on the volunteers today and their own distinctive attributes, it will be important to recognize that volunteers acting alone really are quite limited without involving other stakeholders in the process of support. And there's a theory of resilience around redundancy that also talks about this and plays into this central role as well. So this is one of the themes that I hope that you come away with today, is the importance of having different stakeholders with different qualities acting together to strengthen communities in their efforts to be resilient during times of stress. All right, so the first quality of resilient communities is self-organization. And so with that, how are volunteers and the fact that voluntary groups can self-organize a benefit and perhaps a hindrance also to community resilience? We recognize that volunteers, especially I would say informal volunteers outside of organizations, during times of disaster are able to self-organize, to get together, to help each other. Certainly in the immediate response after disasters, we see a lot of self-organization happening, a lot of self-organized leadership, a lot of teams coming together. But generally, when we think about volunteers as self-organizing groups or even individuals after disasters, one of the benefits, one of the distinctive qualities is their speed and immediacy. So they're able to get there first. They're a large number of volunteers, so in terms of scale, the spontaneity of volunteers can really help during a disaster, again, in the response, but also much later during the recovery phase when people are building and rebuilding infrastructure. The scale of volunteers can be a real benefit and availability. Sometimes volunteers are the only ones to help immediately after disasters, and even again in the long aftermath when other things have fallen off, when the media is no longer covering events, volunteers, because they're embedded in communities, are often there long after others have left. There's a flexibility tied to self-organization that doesn't follow often standard methods and procedures. We can imagine there are both good and bad things about that. but one of the benefits is the innovation. The volunteers can bring different problem-solving based innovative methods towards problems that otherwise often follow the standard protocol and may or may not always be the best solutions. And then we all know about ownership and the importance of having people own their solutions. And when people volunteer, we also find that as self-organized groups, they have a much greater ownership in the outcome. So just giving you one example of this from I think this was a newspaper last week that I looked up. It isn't necessarily the greatest illustration, to be honest, of their self-organizing capacity, because these volunteers were already organized into groups, but it does illustrate how the value of scale, of speed, and of availability of volunteers allowed the UK government to extend its reach and thus strengthen the resilience of people within communities during self-isolation. The government organized effectively up to 2.5 million members of volunteer groups to help to deliver food aid within communities. I think we've all seen examples of this as well, maybe even participated in some of these types of events as the virus has spread and will continue to spread. Another attribute of volunteering, again, it might take a second to advance this slide. Is coordination. As I'm getting there, for some reason, this seizes up every once in a while. But another challenge of self-organization is that there isn't a centralized coordination. So one of the things that this article that I cite here also mentioned was that people wanted to have criminal record checks. So one of the things that they didn't see was people actually being filtered in some ways, or being or having some kind of oversight over who was volunteering, especially as they go to people's homes. All right, I am going to try to escape this so I can advance the slide again. Sorry about the technical difficulties. There we go. All right. The next attribute is connective. And this isn't only relevant to communities. If we think about resilience generally, even in ecological systems, the connective ability of different systems to reach out and help each other is an important part of what strengthens resilience of both communities and ecosystems. What do we mean by connective capacity? Well, volunteers, because they are community-based, they have connections with groups often that are vulnerable groups that if it is a large organization or a top-down approach, that often they are not able to reach. So they rely often on volunteers and the local access that volunteers have to access especially vulnerable people. Because it is a relationship-based or people-centered strategy, there's a lot of strength through informal relationships. Often volunteers, because they are working in community-based groups or organizations, especially in the global south, the importance of their embeddedness within organizations can really help connect communities to national and transnational organizations in ways that often otherwise don't happen. And then obviously, because it is relationship-based, there's also relational bonds that are important for strengthening during times of resilience for people's mental health, for their social support, and many other aspects of relationships. So again, an example taken from, this one was an article from Reuters, where the writer applied lessons from the Ebola crisis to African villages preparing for the coronavirus. And one of the aspects here was saying that the president appearing on TV wasn't going to reach the people that they needed to reach. So they needed to have people going door to door. In terms of connection, you can obviously see this can be both a benefit and a positive to resilience. If people are going door to door, then that's perhaps spreading the virus as well. So one of the aspects of resilience that is both, or connectedness that is both a bonus and a challenge to resilience is that connectedness isn't necessarily discriminatory, meaning that it can both advance and promote healthy communities, but it can also spread bad things, whether that's bad news, false news, whether that's actually a virus. Those are all aspects of resilience that can be a challenge. Another aspect of this, though, is that when volunteers are prepared, it was saying that the Catholic Relief Services, they started a project in Senegal in 2016 where they trained community volunteers, religious leaders, traditional healers, and others. And now they have a network of 400 community surveillance groups of all voluntary that cover about 90,000 people. They are retraining them now to spread the word about the coronavirus, so that when the virus does hit, and that people will be prepared. So again, the importance of the local access and the bottom-up connections is super important. As I mentioned, on the other hand, connection is indiscriminatory. Another principle that is associated with resilient communities and that is also associated with volunteering is social cohesion. There's a certain solidarity or power with others that we see through mutual assistance. This can really strengthen communities during hard times. Part of that is the trust, or the high level of trust that is often associated with volunteering, linked to collective action. This is a distinctive attribute that we heard very frequently in the interviews that we did across, again, hundreds of communities with many different focus groups, is the trust that people have with volunteers and the sense of solidarity that they feel with volunteers. Also with proximity, the fact that community-based volunteers are, again, based in communities and they know people, that there is identification with those who are suffering. This helps them to renegotiate sometimes poor relationships between groups that are fighting or unhappy with each other. And this is especially important where we're talking about conflict as a issue that is disrupting communities. And then finally, the emotional support, that volunteering can help reduce feelings of isolation and alienation, which when we think about resilience is also really important for individual resilience that then scales up at the community level as community-based resilience. All right, again, struggling to advance my slide, but hopefully soon. Looking at an IFRC report, the International Federation of the Red Cross, they did some research last year called From Words to Action, where they looked at community-centered approaches to preparedness and response in health emergencies. One of the things that they looked at was that community volunteers have been a crucial link to strengthening the surveillance of diseases within the communities. They found that community volunteers are viewed as credible, highly valued, trusted, well respected, and these are all, again, qualities that we also saw with through our own research. So many of the things that I'm talking about today are based on research that we did with hundreds of communities, but it's been interesting as I've looked through some of the newspaper reports or media reports and seen some of the examples from other communities that these principles are once again seen across communities. Another thing that is related to social cohesion is, again, the dialogue that can happen to raise awareness. So in this case, with this report, they were looking at cholera and the importance of having trained volunteers that organize all kinds of different events beyond just things that would normally be a public service, including cinemas, including drama groups, where they were able to establish dialogue to really raise awareness around the issues. On the other hand, with cohesion, or the fact that it is a people-centered approach, it can really hinder resilience in some ways. Often we heard discussions about the burden of mutual aid. So as people talked about volunteering within their communities, they felt that the expectations of reciprocity could really burden those who had less to give. that they often felt obligated, even though it should be voluntary, that people often felt that reciprocal action was necessary. We also found that based on the urgency of challenges, whether that's immediate risks or threats, that volunteering, because of social solidarity and proximity, often prioritize immediate and urgent needs over more long-term prevention and adaptation strategies, which again, as a complementary effort, would be something that the governments or organizations could focus on, really helping with the prevention and adaptation pieces, because much of the voluntary action is inspired by the motivations and voluntary action of proximity and urgency. And then certainly the solidarity with whom. People tend to help people within their in-groups. And so because there is no overarching organization or policies that provide standards often for action, when it's only voluntary, we found that people would often exclude those who are not in their group. So that was an important downside of volunteering in some ways that did hinder the resilience of some communities. The next principle is learning and feedback. What we mean by this is that in resilient systems, there are loops that allow people to learn from both learn from past mistakes, but also to receive immediate information about what is working and what is not working in their communities. Because volunteering is ubiquitous, it's widespread. Volunteers are or can be everywhere. Then there is an ability to gather knowledge from many different corners. Some very hidden corners of communities where we wouldn't otherwise know what's happening. Volunteers can gather that knowledge and provide feedback. They can also help diffuse information. So when it comes from the top, again, as volunteers go out and provide learning, they can help give communities feedback through the mechanism of sort of a top-down diffusion mechanism. They can spread new knowledge, and often they can help contextualize information. So within community-based organizations, especially if they're national or transnational, volunteers who know the culture, who know the community, can help contextualize whether that will or will not work. They can help then translate information that they get from the top to their communities, whether that means simplifying the processes or simplifying language. That's all important ways that volunteers can help provide learning and feedback to communities and to organizations from the bottom up. In this example, this is looking at a government society feedback partnership that IFRC established with the U.S. Centers of Disease Control, the CDC, to stave off the Ebola epidemic in the DRC, the Democratic Republic of Congo. It relied on what is often referred to as citizen science. So looking at volunteers who are gathering information and then again feeding it back to organizations to help them learn and provide feedback about what's happening on the ground. In this situation, over 800 volunteers gathered granular, near real-time community perception data that was culturally embedded. So it incorporated beliefs, misinformation, questions, all of these things that IFRC and the CDC themselves could not have had without the participation of really thousands or hundreds of volunteers within this community who are giving feedback back to the organizations. Also, being culturally embedded, volunteers, because they are engaged with communities, can convince others who wouldn't otherwise believe, maybe an organization or even a government, that they can help convince people about the importance, in this case, of quarantine, so that the communities now accept it, whereas before they didn't accept it. As with anything else, there are some challenges with the learning and feedback mechanisms. One that we saw a lot in the research was that it was unidirectional. So knowledge tended to flow from power-laden sources. So even though volunteers had much to give in terms of information and feedback, that often this information wasn't validated, it wasn't accepted by organizations, it wasn't accepted especially by a lot of the transnational organizations. So that was a challenge, that even though volunteers do have that distinctive capacity, it's often not taken advantage of. It's often discounted. And then there's also some concerns about limited expertise. So in the terms of citizen science, there were questions and concerns about the quality of data produced. There were also concerns about just generally the low technical capacity of volunteers to gather and feed data back that is reliable. This was both from the volunteer perspective and the organizational perspective. So both of them saw the challenges of limited expertise and in some ways amateurism, and how this limited some of the information that was produced. Having said that, there's actually been a lot of research around the quality of data produced by volunteers, saying that it is actually quite reliable. So I think that's an interesting difference of perspective, that even though volunteers and organizations see it as limiting, from a research perspective, that data is actually quite reliable. And then the last quality of resilient communities that I'll be talking about is redundancy. The principle of redundancy is basically saying that in resilient systems, having or relying on one actor or one type of actor is a challenge, because when that actor gets taken down, or when there's some problem with that particular part of the system, then the system can't cope. So having redundant actors in a system, or embedded or nested types of actors or institutions, that can really help a community be resilient during challenging times. So one of the advantages, again, of synergy through cross-level partnerships is the value that we get from local, national, and international volunteer collaborations. They are all nested in different levels of a system, and as they act together, in situations where they did act together, they were much more effective than in situations where they were isolated or not providing that cross-level partnership and synergy. This also was evident across not only different types of volunteering, but also volunteering, organizations, and governments working together in synergy. In terms of volunteers part in the system, again, volunteers are often seen as cost reductive, so they're seen as beneficial as a cost reduction measure. This can be, again, both a benefit and a challenge if they're taking advantage of. But one of the real ways that volunteers could provide value is when they were supported by external resources and expertise. So when governments recognized their distinctive value and saw that as a synergistic partnership, that's when we saw volunteering being most effective for resilience in communities, because they were given resources they needed to actually to maximize their complementary value. Just a quick example from lesson learned again from the Ebola epidemic. In this case, primary care was provided by community health volunteers who were able to go out and provide the level of expertise that they had, which when they're trained as community health volunteers, they can provide primary care with more healthy or more serious cases being provided in clinics and different levels. So again, within a system, if there's redundancy at different levels and different actors are working together, this is when you're going to have the greatest resilience in communities. On the other hand, when volunteers are acting alone, and this is what we did see in a lot of communities, that volunteers didn't have the support or didn't have the partnerships with other actors. They were limited. They had a hard time sustaining a long-term, so certainly they could react immediately, but then long-term engagement was difficult. Often there was competition for provisions, especially if volunteering was treated merely as cheap labor, or if it was treated as a replacement for government services. Then there was a lot of competition, and they were again not supported well. There were some concerns that external agencies could undermine or weaken local participation. So there was much discussion about the appropriate balance between volunteers from the bottom up and then organizations from the top down, and how those could be effectively collaborated or coordinated so that the local wasn't undermined by external agencies. All right. So the implications of this, there were some concerns about relying on volunteers during times of crisis. Maybe some of you have experienced some of these concerns. How much can we expect citizens to voluntarily take on responsibility for managing risks? Is this the responsibility of governments, or is it something that citizens can do? Can we actually further strain the already stretched time and resources of vulnerable people? How much can we expect for them to participate when they're already stretched and struggling? Another concern was who benefits most. There were questions about inclusion and exclusion. Again, when we're relying on people's voluntary goodwill, people will sometimes choose to exclude those who are not in their circles, and that can be a real problem for any system that is trying to be resilient. The issue of amateurism or lack of quality, so all volunteers qualified to help, and furthermore, who will help to ensure the safety of volunteers when they're acting outside of systems and organizations that are more formal. And finally, connected with the issue of who can take responsibility, is there an abdication of responsibility from governments? Will volunteer groups be supported during a crisis with the resources they really need to be effective, most effective during resilience? On the other hand, we do see challenges with centralized controls, and so we recognize that the bottom-up or volunteers are important in a resilient system because, like as with volunteers, if they're acting on their, if governments are acting on their own, it can be a challenge, as well as in a lot of situations, there's actually poor political will to implement and coordinate responses. So again, volunteers are sometimes the only resource that's available in a lot of situations of stress and conflict as well. So this is just a quick chart, one you'll find in the State of the World's Volunteering Report, that kind of shows how external actors and local volunteers can complement each other's work. That the importance of this complementary action is really critical for communities to be resilient. So again, as I've talked about volunteering today, we have to recognize that the volunteering in and of itself is quite limited. We're going to go through these implications really quick. I have 3 or 4, but I'm hoping that you also all have some implications that you want to share during our Q&A. One is self-organizing. So I took this quote from the this RH iHub report. It says, support can be mobilized from community volunteers, but this takes thought, organization, and management that is not self-executing. Although volunteer groups can be self-organizing, also a lot of times they fail to self-organize. So we can't assume that leadership is going to magically emerge. With self-organization, also it requires leadership. And so in some groups, that leadership will happen, in others it doesn't. Another challenge is social cohesion. So again, if there's clear organization protocol, if there's standards to minimize the risk that volunteers will choose to exclude people, that is going to be a benefit. One of the implications that I hope that you've heard so far was that we need to match the allocation of resources with the value add that can be gained through effective partnerships. And this isn't just to say that we need equitable resources. I mean, I think that's also true. But just in terms of mere efficiency, if more resources were given to local groups, that would help to strengthen the overall complementary action that could happen from both volunteers, nonprofits, and public organizations. What we find is that actually the allocation of resources is not matched. That even though people assume and know that volunteers are beneficial, they don't necessarily give them as many resources as they need in order to be the most effective in situations. Taken from, again, another IFRC report, it says, although volunteers' comparative advantage in reaching these last mile communities is often observed, their full potential remains underutilized and in some cases undervalued. That we understand that volunteers are really important, especially for meeting vulnerable groups, but they aren't always supported. And knowing that trust takes time to develop and that we have to invest over time. Another importance in terms of the feedback is innovative technologies, taking advantage of platforms that allow volunteers to implement these forms of knowledge, to share what they know. There are lots of strategies for organizational resilience that are being shared now during the crisis, the COVID-19 crisis, and I have a couple links here that I guess you can't actually hit on because this is a certain presentation format, but maybe we can get you these links later if you would like them. 2 more slides and then we'll get to questions. Another one that I think is important is preparation. I think Ken had mentioned this to me earlier as well, that one of the lessons learned from his work is the importance of preparing communities for different challenges. During the cholera outbreak in 2012, having access to long-term volunteers really improved IFRC's ability to respond effectively to the epidemic. We see that a lot of the groups that were organized during both cholera and Ebola outbreaks, that they are now being repurposed and retrained very quickly to respond to COVID. And so, although surge activities are beneficial, they're also very limited if they're not prepared in advance, because it's very difficult during a crisis for communities to organize and self-organize. All right, and so that is the end of my formal presentation. I think as we talk today with your Q&A, hopefully there'll be some other implications that you consider in terms of how the distinctive attributes of volunteering reflect the resilience of your own organizations, your own communities, especially during this pandemic, and the implications that they have for your current reality. So thank you, and I guess over to you, Ken.
Yes, thank you very much, Ben. This was great. Thank you. I think that you, I didn't hype you enough at the beginning because you really lived up to what I said and went further beyond. We do have questions. Let me remind everyone that you can type your questions in the question box, and we will see them, and I will pass them along to Ben. The first one I want to share with you, Ben, is this, and I'll read this literally the way it was written. Can you say more about the issue of screening volunteers? We're struggling with how to manage the risk of doing that and still responding in a timely manner.
Yeah, I think, as we mentioned, during a crisis, I think it's very hard to do things in a timely manner. And so part of the screening issue is thinking about how do we do this before a disaster happens. So a lot of organizations have a pool of volunteers that they have already screened and that they have even trained. We know that there are a lot of challenges with spontaneous volunteering. One of those being that you get volunteers of varying quality that volunteered during a disaster. And I agree, I think it can be very difficult, at the time to screen volunteers. So I don't, I'm not a volunteer manager, so I don't actually have good examples of how to screen. But I will say that in terms of timing, the best way to do that is to screen before an emergency happens, and to have a pool of volunteers that are available and accessible during disasters.
Okay, great. Thank you. I think I want to. There are a couple people have asked the question about whether there is a replay of this available, and yes, it will be posted on the IAVE website. The link will be posted there probably within about 1 to 2 hours after the end of this. It just takes time for it to upload and for us to get the link posted. Let's see. Our organization is supporting young girl volunteers in a village who communicate with women on the COVID-19. How can they do better not to be infected at this time of the health crisis?
Yeah, I mean, that's a real challenge. I think a lot of organizations are struggling with how to protect the safety of volunteers at this time. And I don't know that when we look at lessons learned from, again, Ebola and from cholera, I can't speak to that as well because our research didn't necessarily cover that. But I will say part of it has been acknowledging that volunteers are going to get sick and choosing ones that will be most resilient to that. I don't know if that's a great solution or not, but I know that for a lot of for past projects, part of it has been just risk management, thinking about volunteers as voluntary agents themselves, and trying to help them as organizations the best they can, so they will minimize the risk that they're that they're exposed to. I don't have a great answer to that one, I'm afraid.
Let's see. I think there was a second question related to that about how do community volunteers sustain their effort response efforts without enough basic personal protective equipment and capacity. And the reality, I'd add to your answer, Ben, I think you'd agree, the reality is the volunteers have to protect themselves first and foremost, and not fall victim to the crisis themselves. And that's really a serious, difficult challenge. Here's one: how can we manage the goodwill of help and the risk they could have doing their volunteer work?
Mm-hmm. And this comes back.
What's our message to our volunteers, I guess?
Yeah, I mean, I wish the message could be, you know, we will take advantage of your goodwill, and we welcome that, and we will provide support in this way. Like, we'll give you protective equipment, and we'll provide these different protocol for what, you know, for how to stay safe and things like that. I think the reality is that often we don't have that complementary support, again, as much as we need from both organizations and governments. So volunteers go out with their goodwill and are sort of left on their own. So I would say, you know, again, maybe not a super insightful comment, but as much support and resources as you can give volunteers to help support their goodwill, I think is really all you can do. If you can prepare for that, if you can, you know, lobby governments to get more support for voluntary action, like those are all things that would certainly help in the long term. In the short term, I think it's a challenge of just really sufficing and helping as best you can.
Okay. In this question, in your examples, you clearly talk about local volunteers emerging from the communities. What about volunteers from abroad, people who are professional and are engaging on specific issues? Do you think that they can have a valuable input reinforcing the capacities of local organizations, or would you advocate for local volunteering only?
Yeah, so I definitely think that international volunteers can and are important during emergencies and crises, many examples of that. And I wouldn't only advocate for local volunteering. Coming back to the point of complementarity, I think the issue is saying all these different actors bring different skills and capacities and resources to the problem. And to the degree that we can help them coordinate and sort of collaborate on these issues, then it will be really helpful. One of the challenges, though, is that so if we look at the global risk report in 2020, global risk report, about 98% of all humanitarian aid dollars went to international responders. That is a lot of money that goes to international responders. Less than 0.3% went to local volunteer groups. So if we think about the complementary action of actually who's doing the lion's share of work, the lion's share of work is being done by local volunteers often, but they're getting a very small amount of the resources. In reality, some of those resources that are given to international responders are being filtered down, are being, I would say, delegated to local volunteer groups and local NGOs, but not nearly enough money is devoted to local response efforts. And there's some reasons around, certainly around the ability to manage finances, the ability to you know, do a lot of these things that there's a reason for that. But I think we need to give some serious thought about who is getting the bulk of resources versus who is actually doing the bulk of the work.
Okay. One more. On your slide on concerns about relying on voluntary action in times of crisis, can you share any answers to the raised questions?
So I have to go back to that slide. Which slide was it again?
The one, concerns about relying on voluntary action in times of crisis.
I'm gonna have to look up what that was, but I don't remember the questions I asked, to be honest. Do you happen to know, Ken, which? No,
I hear it. It was toward the end, I think, were the
okay,
slides.
I'm seeing it now. Yeah, I think there's a lot of concerns there. So I think it's hard to answer that in one sentence. But one was like, how much can we expect citizens to voluntarily take on responsibility to manage risk? And I think surprisingly, we can expect I mean, I don't know if we can expect a lot, but certainly volunteers do respond in large numbers. and often, and even in situations where we don't want them to necessarily. The spontaneous volunteers that do respond sometimes when there's a lot of risk to their personal safety, when we don't necessarily need their help because they don't have the skills. Those are all challenges that come up. And even though sometimes we don't want those volunteers, we get them. So I will say, even though that is a question that comes up, I think volunteers are willing to take on that responsibility often. And same with the idea of, can we strain the already stretched resources of volunteers? Should we? I think is the question. From a moral standpoint, should we ask more volunteers, even though they're willing? Should we actually expect that of them? So I think it's actually less about the volunteers themselves than what we're actually willing to or asking them to do.
So one final question before we wrap up. On balance, given all of your research, how valuable and effective do you believe volunteers are in a crisis? Are they a critical resource?
Yeah, I think that a very important question is, I guess, a wrap up, and I would say absolutely. I hope one of the lessons that is taken away from here is that volunteers are critical. They are an essential component of any resilient community. And if we assume that they are only a low-cost resource, or if we assume that they are cheap labor, and that's all that we're attributing to them, then we are doing a major disservice to voluntary action. They bring a lot of distinctive attributes that organizations, that governments do not and cannot provide. And so they are essential for, I think, the survival of communities in a lot of areas of the globe where governments and organizations are just not even functioning. So I think if we recognize that and really gave more value to the essential role that volunteers play in communities for their resilience, but also for dealing with stress and in conflict, in any kind of shock situation, then and supported them with the resources that they really need to be the most effective that they can, then we would see a big uptake in the resilience of communities. So absolutely important, essential in any efforts to be resilient.
Great. Thank you, Ben, for that great wrap-up answer. I want to thank you for being with us today. We're reaching the end of our allotted time here. I want to remind everyone that IAVE will have posted on its website, iave.org/COVID-19, what you're seeing on your screen now. We will have the recording of this webinar available, along with links to the various resources and to Ben's presentation. So we urge you to visit the website. Let us know. You can write to info@iave.org with your own ideas, with your own experiences. We'll be happy to have them, and we'll be sharing those kinds of things with the field. So please check back with us. Thank you all for participating. We had registrants today from over 60 countries. We were very pleased to have you. Please check the schedule for future IAVE webinars. And in your own way, collectively, let's say thank you to Dr. Ben Lough for his excellent presentation and participation. Thank you very much, and have a great day.